Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me or Mukherjee with you after a long time showing you my face. And yes, we have a light problem, so that's why you can't see properly my face. But it's okay. That's the not main topic for today. We have a great topic to chat. So, before that, we are still trying to get back on track about that e-participation certificate. We are trying our best, so please just cooperate. And again, uh, without wasting any more time, let's just jump into our 30 seconds countdown time. So here we go.
Good evening, everybody. Good evening, sir.
Good evening to all of you.
With blessings of our seniors, a love from our batchmates and juniors, slowly and very steadily, we had crept on to the 118th episode of Continued Medical Education Session, organized by National Institute of Homoeopathy Alumni Association. And this is a educative session. We all are students through our entire life and we will continue learning. Tonight, we have a set of young, energetic, new set of speaker, moderator, and inaugurator. With the permission of our beloved President Kalyani sir, let us call our inaugurator today, Dr. Sanjib Sahoo. He is an alumnus of National Institute of Homeopathy, and he himself had very recently joined in NIH as an assistant professor in the Department of FMT. I'll request Orko to bring Dr. Sanjib Sahoo on screen, please.
Please, please, welcome.
Uh, very good evening to all of you present here, respected Dr. Kalyani sir, Dr. Bidyut Mukherjee sir, and all my seniors and my teachers who are present here, joined 118th CME of National Institute of Homeopathy Alumni Association. Uh, our CME has started its journey since 2020. Before that, offline sessions were quite regularly. It was organized in NI seminar hall. I have attended some offline sessions of CME of National Institute of Homeopathy Alumni Association. Uh, My name is Dr. Sanjib Sahoo. I am 24th batch UG and 21st batch PGT of National Institute of Homeopathy. Currently working as assistant professor in the Department of Forensic Medicine and Toxicology in our alma mater. It is a great privilege, and obviously this is the blessing of my teachers, my gurus, and obviously love of my batchmates and senior juniors. Today we have got a great personality who is very famous in his clinical acumen and clinical expertise, and he is a successor of the legacy of great J.N. Kanjilal sir, and we have heard his name, Dr. Arinjit Chatterjee. He is sixth batch UG of NIH, very dedicated person, a very learned person, continuously engaged in studying and acquiring knowledges. You can see the background of Dr. Arinjit Chatterjee. It is full of books. And sir is telling that পড়াশোনা না করলে কি করে হবে, না হলে পেশেন্ট সারাবো কি করে। Great inspiring words that how can I treat my patient if I don't engage myself in continuous studying and continuous improvement of my clinical knowledge. Another very great personality we have got today, Dr. Abhijit Chakma. He is 13 batch UG and 16 batch PG of National Institute of Homeopathy. Dada is currently working as a research officer in Regional Research Institute of Agartala, Tripura. Uh, so without delay, let's welcome Dr. Arinjit Chatterjee as moderator of this CME 118 CME. Uh, Sir, please continue.
Okay, thank you, Dr. Sahoo. I'm Dr. Arinjit Chatterjee. First of all, I would like to pay my respect to Dr. Honeyman, then Dr. Kalyani sir, and Bidyut for organizing such great events for our not only for the education of us but keeping us up to date with all latest medical topics. So, and I would also like to thank Dr. Sahoo and congratulate him because he has recently been selected as assistant professor of in NIH. So today's topic is erosive antral gastritis, and a case will be presented to you, and I am very eager to hear about that case along with you. So I'll just tell you the basic things about what is erosive antral gastritis. What are we about to talk? What are we trying to talk or learn from here? So basic concept is erosion of the gastric mucosa at the level of antrum. So what are the cause? What happens? Whenever we have an erosion, we have lot of symptoms, and we will come to that later on. But first, let us come. What are the cause? The immediate cause is non-steroidal frequent intake of non-steroidal anti-inflammatory drugs, NSAIDs as it is called. Then is alcohol, stress, and stress caused by burns, sepsis, trauma, surgery, shock, and so on. Rare causes include radiation, viral infection, shock, cancer, chemotherapy, uremia, ischemia, shock, etc. Next, what are the pathology? What pathology would we encounter when we are talking about this subject? So there is, we will divide it in two parts. One is superficial erosion and other is deep erosion. Superficial erosion usually occurs after 12 hours after the initial insult, and there is punctate mucosal lesion. This occurs at the initial level or at the superficial level. And after that, if the case is remained untreated, then either there is ulcers, and that may or may not accompany perforations. And that is the reason we have to be very careful about it when we are encountering such a medical condition. And here we have a special type, which is called acute stress gastritis. What's that? It's a form of erosive gastritis in critically ill patients. So whenever we are having a patient admitted in ICU, due to the reasons that we have already mentioned, such as head trauma, burns, mechanical ventilation, and so on, the patient can have this erosive antral gastritis as a complication, and the incidence is no less than 5% in all critically admitted patients. Now we come to the symptoms in brief, of course. The symptoms are either asymptomatic, that is, patient is unaware that anything has occurred to him. So he may or may not seek medical attention, or we may accidentally diagnose it when the patient comes to us for some other problems. Okay, so first is asymptomatic, and second is symptomatic. Symptomatic is, what are they? They either dyspepsia, either it may be nausea, it may be vomiting, it may be even serious conditions such as hematemesis, melena, or when the patient is inserted nasogastric tube, when the nasogastric tube is inserted into the patient's mouth. Then what happens? They are made with bleeding. Okay, and what is the diagnosis? diagnosis is mainly upper GI endoscopy and CBC, where you can find anemia. Why anemia? Because the patient there is internal bleeding, and the stool, what you find in the stool, you might find occurs that test being positive. Now I'll tell you what are the ICD codes or International Diagnostic Code. This erosive antral gastritis usually falls on the category of ICD-10 CM, and under this category there are two subcategories. What are they? Subcategory is K25 with K2960, which is erosive antral gastritis without bleeding, and another subcategory is K29.61, which is gastritis with bleeding. And we have to be very careful about the complications that might arise. What are the complications? Complication is Helicobacter pylori gastritis, reactive chemical gastropathy, gastric antral vascular ectasia, and portal hypertension gastropathy. So this is in brief the subject about erosive antral gastritis, which we are going to learn, we are going to experience, and we are going to happily incorporate our experience in what our latest speaker speaks about. So, without any further ado, I will hand over the case to Dr. Abhijit Chakma for further elaboration. Thank you very much.
Good evening to all. Respected Kalyani sir, our president of NIH Alumni Association, and Bidyut, the secretary, for inviting me in this 118th CME. This is conducted by our Alumni Association regularly. Earlier also I have given a lecture on another topic. So today my topic is antral gastritis. A case has been treated successfully with homeopathy. So actually I am presently working as a scientist too in CCRS, Central Council for Research in Homeopathy, and presently posted in Agartala. So this case is one of my success case stories. I have published this case in homeopathic links. So let's start the actually case in detail. Dr. Arko. So a case of erosive antral gastritis treated with homeopathy. So as Arinjit sir already said that what is gastritis? It is gastritis is inflammation of the stomach lining, often caused by factors like infection, certain medications, or alcohol, and it can lead to symptoms like stomach pain, nausea, and vomiting. This is a very common disorder, gastrointestinal disorder, commonly affects children and adult age group. This is the picture that normal our duodenum, that stomach and duodenum part, and this is the erosion in right hand side. There is inflammation. So my case is antral gastritis because the affection was in antral part of the stomach. So it is the antral gastritis, is the inflammation of the inner mucosal lining in the antral part of the stomach. So broadly, there are two conditions, that is acute and chronic gastritis. They are the main two main categories. Stomach lining irritation that occurs suddenly is known as acute gastritis. And acute gastritis is a broad term that refers to a variety of conditions, some of which include inflammatory alteration in the gastric mucosa. When the entire stomach becomes inflamed, it is referred to as pangastritis. Whole of the stomach is inflamed. And when only a portion of the stomach, in my case, it is antral part, so it becomes inflamed and it is referred to as antral gastritis. It may be erosive, non-erosive. So my case is one that is erosive. So as already told that the main causes non-steroidal anti-inflammatory medications use an Helicobacter pylori infection are the main two reasons for occurrence of gastritis. Overall in globe, the Helicobacter pylorus is one of the most common cause. Another that alcohol, stomach, cocaine, severe illness, autoimmune diseases, radiation therapy, and Crohn's disease are less frequent causes. They are the causes, but they are very less frequent causes. There may be no symptom in earlier stages, but when symptoms are present, the most common symptom is upper abdominal pain, dyspepsia. Other possible symptoms may include nausea and vomiting, bloating of abdomen, loss of appetite, and heartburn. The clinical manifestation, laboratory test, gastroscopy, histological and microbiological examination of tissue all play a role in diagnosis of gastritis. Till date, upper GI endoscopy is used as a gold standard to investigate, to understand the pathology in gastritis. Other tests like blood test can help to detect infection, H. pylori infection, and check for anemia, because there may be bleeding, erosive gastritis, there may be some ulceration also in our stomach. In that case, there may be internal bleeding, and so patient may have anemia. This is generally occurs in chronic gastritis. Stool examination may be there, and one of the tests, that is urea breath test. In urea breath test, what happens? The patient is given some liquid which contains urea, a substance that H. pylori can break down into carbon dioxide. Then a sample of breath is taken from the patient, tested for carbon dioxide to determine whether the H. pylori infection is there or not. So gastritis is very common among children and adult age group. It can cause negative impact on health and hinders the quality of life. As you know, अगर पेट ठीक नहीं रहेगा तो पूरा दिन ही बर्बाद हो गया. Everything actually starts from our stomach. खाना ठीक ठाक डाइजेशन हो रहा है, दिल खुश, काम भी सब ठीक ठाक होता है. So it can cause negative impact on health and hinders the quality of life. So for treatment of gastritis, our target should be to prevent recurrence. Number one, to prevent recurrence. The medication should have less side effects and to reduce the cost of medication. So three things we have to keep in mind, that we have to prevent the recurrences, less side effects, and to reduce the cost of medication. So considering this aspect, three aspects, homeopathic treatment may be one of the useful, safe therapeutic option for treatment of gastritis. So if we go through the homeopathic therapeutics, different Medica and available resources that recommend a variety of medications for this symptomology, that is nausea, vomiting, pain, abdomen. Those are very common in gastritis. And Nux vomica, Lycopodium, China, Carbobase, Pulsatilla, Arsenicum album, Chelidonium, Robinia. These are the common homeopathic therapeutics for gastritis. So there is homeopathy has not been fully acknowledged in the scientific community, despite being discovered several years, due to a dearth of studies that provide substantial evidence to support it. Actually, there are lots of many physicians, homeopathic doctors, they are treating gastritis cases very successfully, but they are not coming into the scientific domain. They are not actually reporting in proper way. So that's why our case has been, this case report has discussed to strengthen the recognition of homeopathy as evidence-based science. So coming to the actually case summary, a male patient is at 31 years, came with complaints of abdominal pain. This is the main actually common symptom of gastritis, especially after eating, with nausea, vomiting, and distension of abdomen for the last 10 months. The patient came with the upper GI endoscopy, which confirmed that the patient is suffering from antral gastritis. So after detailed case taking, those particular symptoms, physical general, mental symptoms, past history, family history, after taking all the details, symptoms were analyzed and evaluated to construct the totality. And after constructing the totality, we have prepared the case with homepage software, and the following characteristic symptoms were considered for the constructing the totality. The patient was very anxious, irritable. He always wants to stay alone, desire for sour things, and aversion to salty food. The patient was chilly patient. His sweat was offensive. There was pain in upper abdomen, which aggravates after eating with nauseatic tendency. There was also fullness and distension of abdomen, which ameliorated by erectation. As already said, that the diagnosis of the case was made through the endoscopy report and also based on the symptomology, physical examination, and the presenting complaints. So after repetition, there were carbobase, sepia officinalis, sulfur, nux vomica, heparsol, phosphorus were the leading medicines in this case. So carbobase covered maximum among all medicine. Carbobase covered maximum symptoms with highest score in repetition, and thus it was prescribed in 0-1 potency and continued up to 0/7. I will discuss later on why we have used the LM potency in this case. So apart from medication, the patient was advised to avoid fat-rich diet, spicy food, smoking alcohol, and to consume fiber-rich diet, plenty of water, and eating small frequent meals. The 50 millisimal is as we know that 50 millisimal potency is the safest, and it is very effective in ultra diluted form. Henneman's assertion was that the nanotechnology, recent studies in recent research in nanomedicine and nanotechnology has shed light on the potential effects of ultra dilute solution on biological system. What we are using in 50 millisimal potency, we are using very ultra diluted form of medications. So there is less chances of side effects from medicine, adverse effects also. While the exact mechanism are still debated, studies have suggested that even highly diluted substances can have biological effects through nanoparticle interactions. So what happened? The patient was treated for 9 months with gradual and significant improvement observed both clinically as well as changes in diagnostic parameters. What the patient brought earlier, the upper GI endoscopy, we have done the upper GI endoscopy periodically. So after 9 months, upper GI endoscopy report revealed normal study after 9 months of homeopathic treatment. To assess the pain, there is a scale, visual analog scale. Actually, in research, we have to use the scale, various scale, based on different conditions. For pain, actually, there is a common scale, that is visual analog scale. So we have used this, and initially the pain score was +8, and after 9 months, it became 0. So it suggests the improvement of patient in terms of pain. And another tool is there, Monad. In addition, the high score +8 of Monad suggested that the likelihood of improvement of presenting complaints was attributed to the homeopathic intervention. Actually, Monad is a tool by which we can understand the homeopathic. You have given the homeopathic medicine, and whether the patient improved from your homeopathic medicine or not. Through this tool, we can assess. So anything above like more than 4, 5, 6, 7 up to 9, 10. Our case is +8. So it suggests the strong likelihood that the improvement is due to our homeopathic intervention. So in conclusion, the case report shows that individualized homeopathic medicine in LM potency is beneficial in the management of antral gastritis. LM potency minimizes the risks of any potential toxic effects from the original substance while still retaining its therapeutic properties. And thus, LM potencies have the advantage in chronic conditions of being the gentlest of all methods of homeopathic medicines to act, especially in chronic sufferings. In research, actually, we have certain future plans also, strategy. Like in our case, although this single case report cannot draw firm conclusion about effectiveness of homeopathic medicines in antral gastritis, more and more number of documented cases and scientific research studies would help to establish this fact that yes, our homeopathic medicines act in antral gastritis. So this is the upper GI endoscopy report. This is 24th March 2022. The impression was erosive antral gastritis. And it is almost like after 3 months during the treatment, we have assessed the condition through upper GI endoscopy. The report came as mild antral gastritis. And after treatment, it is like 29th November 2022. The impression was normal upper GI study. Here it is to inform that this procedure, that upper GI endoscopy procedure, is quite painful for the patient. We are very much thankful to the patient because the patient has obeyed, has followed our advice, and he has undergone regular endoscopy report. Generally, doctors advise endoscopy, but the patient do not turn for the endoscopy because of this painful procedure. So we are very actually thankful, and we appreciate the patient who has followed the advice. Regarding this case report, this article has been published in Homeopathic Links Journal. You can visit this link to get the access of that article. For any query, you can also drop me a mail or you can call me at this number. And since this is a case report, I will say more about how to write case report in scientific way, so that this case report is being accepted by medical scientific community, especially by the allopathic doctors, because there should be some standards while writing case reports. Dr. Orko, can you please start that PPT? This is a screenshot of my publication.
Sir, just re-upload it once again because it's you have to upload it one by one. So just
Okay,
re-upload it. Hmm.
just a minute, because this part is very essential.
You just go to the present button. It's being uploaded, so you just go to the present button and click on slides. You can see your uploaded slides over there. Yes, sir. It has come.
Yes, just actually this will help all of us, especially those doctors who are not acquainted with how to write case reports in scientific way. So how to improve writing case reports in homeopathy? Why homeopathic? That case reports are very much essential for our system. Actually, case reports are they are very actually valuable, and they are valuable resources of unusual information that may lead to new research and advances in clinical practice. Many journals and medical databases recognize the real time-honored importance of case report as a valuable source of new ideas and information in clinical medicine. Case reports can highlight unusual disease presentations, novel treatment responses, or unexpected side effects, which can inform clinical practice and guide future research. I am telling here, this is highlighted in red, unexpected side effects. Many of us actually claim that homeopathic medicine does not cause any side effects, but there are cases where there is side effects also. If we follow the principles of homeopathy, there is less chances of side effects. Otherwise, what happens if we don't follow the principles of homeopathy? If we give doses, multiple doses at frequent interval, there may be chances of side effects. I'll show a case report where allopathic doctors have reported that through homeopathy there were some side effects. So case writing serves as a crucial link between theory and practical application. So during our UG time, we have learned many things from our teachers, from our professors, from our learned teachers, that like this medicine acts beautifully in these conditions. But whenever we have seen our these cases, these type of cases in our OPDs, IPDs, during our internship or during our PG time, then we get the confidence that yes, our medicine is working. So this is case writing serves as a crucial link between theory and practical applications. A good case study should be clear, concise, and engaging, focusing on a specific situation to demonstrate a problem and its solution. I was talking about a article which shows that homeopathic medicine, that a case of suspected homeopathy induced Stevens-Johnson syndrome in a pediatric patient from Bangladesh. So Stevens-Johnson syndrome, you may have know this condition is a very severe condition, even life-threatening condition. So through homeopathic medicine, they have cited that through homeopathic medicine, the child has developed this Stevens-Johnson syndrome. You can go through this article by citing this. This is published in 2025, May, just recently published, 1st May 2025. So very interesting case. You can go through this. Just type this one, that a case of suspected homeopathy induced Stevens-Johnson syndrome. If you go through the case, then you can understand that what homeopathic medicine can cause. The article is actually showing the documentary evidence also with pictures, the what happened to the children. So I appeal or request everyone who is watching this CME to go through this article, and you can understand that homeopathic medicine also can cause side effects. In research, actually, the policy makers, whenever they like funding for homeopathy, they go for research paper. They don't argue in verbally, they need papers. In papers, they need this type of any trial you have, any observational trial, case report or series. If I tell the hierarchy of evidence, the most strong and most strong evidence is systematic reviews and meta-analysis. And then comes to below that one is randomized control trials, then observational trials, and at the bottom line it is case report and series. Although this case report and series is in the bottom line, but they are the actually foundation for our observational trials also, because they are indicating us or giving some clue that this may be done in future also. So we should not forget this bottom line. Without this bottom line, the higher things cannot happen. So case report and series is very important. So while writing a case, there should be some standards. क्या होता है कि जैसे KFC होता है, they have some procedure. कलकत्ता में जो KFC मिलता है, अगरतला में जो KFC मिलता है, and दिल्ली में जो मिलता है, their taste almost similar. It may be like 1% थोड़ा इधर उधर हो सकता है, but it's almost same. How this can be? Because they have certain perform certain guidelines, certain procedure they follow in each center at Delhi, Kolkata, Agartala. That's why they maintain the same taste, same flavor. Similarly, in our case report also, we have our own guidelines so that it should not deviate कि कोलकाता में जो लोग केस लिख रहे हैं उनका अलग हो रहा है, जो होम्योपैथी में केस लिख रहे हैं उनका अलग हो रहा है, प्रेजेंटेशन जो हो रहा है, एलोपैथी में जो लिख रहे हैं दे हैव सर्टेन, वो अच्छा लिख रहे हैं, ऐसा नहीं होता है, बट वी हैव द गाइडलाइंस. सो दिस इज a general guideline, that is CARE. In 2013 it came. CARE means for case report, this guideline. So there are 13 checklist. एक केस रिपोर्ट में क्या क्या होना चाहिए वो 13 चेकलिस्ट इसमें दिया हुआ है. इन टाइटल देयर इज नंबर 1 इज टाइटल. You have to, there should be the diagnosis or intervention of primary focus followed by the words case report. Every time whenever you are writing a case report, at the last or the beginning में आपका case report लिखना ये mandatory है. Like in my case, a case of antral gastritis, erosive antral gastritis treated homeopathically. So case report शुरू में था. So this कैप्शन में जो लिखा हुआ है केस रिपोर्ट वो होना चाहिए टाइटल में. कीवर्ड्स यू कैन कीप 2 to 5 कीवर्ड्स इंक्लूडिंग केस रिपोर्ट, बिकॉज आप जब भी कोई चेक करेगा उसमें केस रिपोर्ट लिखेगा तभी ये सब शो करेगा जल्दी. एब्स्ट्रैक्ट, द एब्स्ट्रैक्ट should be structured or unstructured. आप in case report you can follow both the structure and unstructured. क्या क्या होना चाहिए वो उसमें लिखा हुआ है. in about introduction about the disease condition, what the therapeutic intervention used, clinical condition क्या था, diagnosis, how it was diagnosed and what intervention was given and outcome with conclusion. Conclusion means take away lesson from this case report. जैसे मेरा just case report मैंने discuss किया था. The takeaway message was that individualized homeopathic is effective in erosive antral gastritis. Like आपको ऐसे लिखना है. So 3 points. Then comes the introduction. This introduction part comes about the disease condition, your uniqueness in the case with literature reference. Then comes to the patient information. Patient कौन सा एज का था, मेल फीमेल, कौन सा बैकग्राउंड में था, उसका हिस्ट्री. These things have to be mentioned in under patient information. Then clinical finding, systemic examination, physical examination, what you have seen you have to write down. And timeline. Timeline means abhi the patient came with the complaint of like abdominal pain, how it started, how many years back, how many times, how many months back it has started, what treatment he or she taken, ये सब आपको लिखना होगा. Diagnostic assessment, you have to write down the how you have came to this diagnosis, आपको ये लिखना पड़ेगा. Then therapeutic intervention, whether आपने सर्जिकल किया, कुछ प्रिवेंटिव या थेरापेटिक, जो होम्योपैथिक थेरापेटिक यू हैव गिवन विथ डोजेस, फ्रीक्वेंसी कितना यूज किया, यू हैव टू एक्सप्लेन हियर. एंड फॉलो अप एंड आउटकम्स, फॉर हाउ मेनी डेज द पेशेंट वाज फॉलोड अप, you have to write down systematically. Then discussion part, you have to discuss the strengths and limitation in your approach in the case. similar case studies whether earlier published or not, उसके साथ आपका क्या differences या similarity है. If there is similarity, then it is very good that there is strong evidence. आपका एक जन ने बोल रहा है कि acute antral gastritis is curable with homeopathy. दूसरा जो studies आया, तीसरा जो आया, वो भी बोल रहा है कि treatment सही है. Then our evidence becomes more stronger and stronger. So ऐसे we have to discuss our strength and limitation in our approach. हो सकता है कि like psoriasis case, which is actually by nature it is chronic and it recurs annually or subsequent months, subsequent years. तो हो सकता है कि you have followed up only for 3 months, 6 months. उस टाइम में कुछ नहीं आया, लेकिन later on patient फिर बाद में नहीं आया, you have not unable to follow up that patient. So in that case, you have to write down the limitation that we have followed up the patient only up to 9 months, 3 months, because basically the patient should have followed up for like 1 year, 2 years to see the recurrence, whether there is any recurrence or not. So patient perspective, the patient should share their perspective on the treatment they receive. You can take some bite from the patient or some documentary by written document that what was his experience with your treatment. So you can write down. You can ask the patient to write down, and also you can make a video or bites about the treatment. Then lastly, informed consent is very much necessary, and it is unethical if you don't take the informed consent without the consent of the patient. If you publish the case, it is very actually punishable offense also. If the patient sues you in court, then it is punishable. In care guidelines is actually general for everybody. This is homeopathy, allopathy, Ayurveda. Everybody have to follow this guideline. Little added version is home case guideline. Little that what to say, extension of the care guidelines. That home case, homeopathic clinical case reports provide a standardized approach to reporting clinical case reports in homeopathy, developed as an extension to the care guidelines. What I have said earlier, care guideline, it is the guidelines is for all. It is uniform for all. For homeopathic part, because our medication is totally little bit different, individualized medicine we are giving. Our potencies, dilution, everything is different. That's why there was a little change in our approach while reporting a case. So this is the just as an extension of the care guidelines. They offer specific items and criteria to improve transparency and accuracy in reporting homeopathic treatments. These guidelines are particularly important in homeopathy due to the individualistic and complex nature of homeopathic practice. So who has developed this home case guidelines? Dr. Ben Haslan and his team. By using Dept technique with a panel of 19 homeopathic experts all over the world. 19 homeopathic experts all over the world, they have consulted by using Dept technique. Dept technique is actually discussion type. They have made the format, and they have provided that format to all the 19 experts, and that 19 experts, they have given their own suggestion, and by editing or deleting many things, they have ultimately concise to a particular guidelines, that is home case guidelines. So what is key features and benefits of home case? Home case provides a structured framework for reporting, ensuring that key information is consistently induced in case report in our homeopathy. This is specific to homeopathy. This home case guidelines is specific to homeopathy, which addresses the unique aspects of homeopathic practice, such as type of homeopathy used, whether you have this polypharmacy, individualized, biochemic, or dilution, mother tincture. This type of which type of homeopathy you have to mention. The clinical history from a homeopathic perspective, the detailed description of homeopathic medications, And by home case, it improves the transparency and accuracy, which helps to reduce bias and improve the quality of case reports, leading to a more reliable understanding of homeopathic treatment. So if we follow the home case guidelines, if I am writing and following the home case at Agartala, Kolkata, Bangalore, Delhi, and we are following the same prescribed format, then there will be uniformity, and there will be transparency and accuracy in reporting our case report in homeopathy. It is widely applicable, complementary to care guidelines. It is already told that it is the extension of the care guidelines. Home case builds upon the existing care guidelines, adding specific elements relevant to homeopathy. This promotes scientific rigor, enhances understanding of homeopathy, supports clinical practice, and facilitates research. Checklist of homeopathic guidelines. Actually, this checklist is based on the article published by Ben Haslan and his team. This is published in 2016. I am just sharing this screenshot of the checklist. This is almost same like care guidelines, which is applicable for all the system of medicine, allopathic, Ayurvedic, homeopathic. It is all same. What is different is just highlighted in yellow that clinical history detail, homeopathic symptom is used for decision, etc. Because we know in allopathy or Ayurveda, they are not going for details, actually case history, like fast history, the birth history, what happens. Yes, sir, we are taking all the details in our case taking. Then therapeutic intervention, type of homeopathy. This is not mentioned in care guidelines. This is specific to our homeopathy, home case guidelines. Type of homeopathy, individualized, formula, single or multi-constituent, isopathy, medication nomenclature is necessary, whether the medicine is manufactured by the GMP certified company or not, potency you have mentioned or not, scale and galenic form you have to mention in our case report in homeopathy. All other things are almost same. You have to write down whether there is any objective evidence you have during follow-up, like in case acute gastritis. I have mentioned that there was upper GI endoscopy we had before treatment, during treatment, and after treatment. These are actually objective evidence. Any occurrence of homeopathic aggravation, also possible attribution of changes explicitly assessed or discussed. Monarch table can be used to know the causal attribution, relationship between what you have prescribed and the outcome, whether there is any relation, whether the outcome, whether there is the improvement is due to your homeopathic treatment or any other outside external issues, factors. Already discussed that objective evidence means it may be blood reports, it may be sonography, X-ray reports. Homeopathic aggravation, all homeopathic doctors actually they know that this is a temporary worsening of pre-existing symptom within a plausible time frame after administration of a homeopathic medicine, followed by improvement of the patient's condition. And causal attribution of changes, monarch table, we can use that. In conclusion, case reports are very valuable resources of unusual information that may lead to new research and advances in clinical practice. Only few physicians in training receive formal education on what constitutes a publishable quality case report. During our actually UG time, कैसे case report publish करना होता है, whether really it is necessary to publish the case report, we don't actually, उतना information हम लोग के पास था भी नहीं, and उतना I think उतना stress भी नहीं था, उतना pressure भी नहीं था. But nowadays actually in present era we need more and more scientific research papers like case report, case series, so that जो planning कर रहे policy maker, we can show them, yes, these are the cases, these are the case report, these are the research paper that we have, that homeopathic medicine are actually working. There should be medical education continuity focusing on creating more awareness about the importance of writing and publishing good quality case report. I think even PG time also हम लोग के टाइम में उतना नहीं था. I don't know अभी recently क्या हो रहा है. I think there should be continual education CME type जैसे अभी आज हो रहा है. Focusing the importance of publishing the case report, case series, research paper. आपके पास हो सकता है you are treating lots of patient and there are lots of success stories also. So just don't concise those things in like seminar or just in verbally. Just publish at least 10% of those cases in scientific way. So it will help our system in general. और इसके साथ साथ क्या होता है कि whenever you publish a case or case report, research paper, people sitting abroad, आपसे 100 किलोमीटर दूर है, 1000 किलोमीटर दूर है, he or she knows that so and so doctor has published ये केस रिपोर्ट होम्योपैथी के ऊपर. सो वन वे ऑफ इट इज एक्चुअली नेम एंड फेम के लिए भी होता है जो पब्लिकेशन. For any query related to this home case or care guidelines, you can also contact me via phone, email or Facebook. Thank you all. Thank you the president of our NIH Alumni Association, Bidyut the secretary, our moderator Arinjit sir, and also the inaugurator Dr. Sanjib Sahoo for inviting me in this 118th CME. I hope the listeners, they have learned things about home case care guidelines and the case in general. So with these words, I am concluding my speech here. Once again, thank you all. Thank you, the organizer. Thank you. Dr. Rako, over to you.
That was an excellent session, I must say. In fact, we covered two important topics at the same time. Especially the second one was very impressive and very interesting because nowadays most of us don't know how to write a paper scientifically and submit a paper scientifically so that it gets the attraction and attention of the medical community at large, irrespective of homeopathy or allopathy or whatever. So we would like to thank Dr. Sahoo for presenting this wonderful paper and this wonderful presentation. And we would always acknowledge that he did a wonderful job and wonderful thing to highlight us the importance of how to present a case and how to get it acknowledged scientifically. So I will now hand over the thing to Dr. Orko and Dr. Bidyuta and Sir to kindly conclude the session. Thank you.
There is a question on screen from Mr. Chandan Shahani of Uttar Pradesh, for speaker and moderator. Can you read it?
Yeah, it is visible. So, Chandan Shahani. So there is a problem like after 1 or 2 minutes after eating, there is feeling of something stuck in my throat. So I think this is not related to any like gastritis. You may have some I have no issues with drinking water or intake food. So maybe there may be some dyspepsia issue. There may be some like gas problem also. You just check it. For how long you have this problem? Actually, we don't know. Actually, we don't have the details. You can share the details in my mail or even WhatsApp in detail for how long you are suffering from this condition. It happens sometimes due to some bloating of your abdomen, like from even dyspepsia also, from gas also. It's a minor issue.
Okay, the viewer, I think you can get in touch with Dr. Abhijit Chakma. He will share his email ID in the comment section. In the comment section of the YouTube, you can directly get in touch with Dr. Chakma or any other government homeopathic hospital near your Uttar Pradesh where you stay. Or obviously, you're welcome to National Institute of Homeopathy outdoor or any government homeopathic institution near your place. Thank you, Dr. Abhijit. And Arinjit had already, he's not on the screen. Over to you, Dr. Kalyani, sir, for your comments and your input, sir.
Thank you, Bidyut. Many, many thanks. First of all, I must thanks wholeheartedly to our inaugurator, junior brother, Dr. Sahoo, for coming forward and participating in inaugurating the program which he has inaugurated. Next, our moderator, Arinjit Chatterjee, is a renowned person. He has given some introduction and moderation was nice. Many, many thanks to Chakma. Fantastic presentation. This is wanted. Let me first tell you the second latter part of Dr. Chakma. That is, repeatedly I request all of you that homeopathy has many things, many things, but only lack of documented presentations. That means scientific world wants to know that scientifically we are curing the cases. That is highly wanted by this, not only for the homeopathy, but also for the countrymen. Whole world is awaiting to see that yes, scientifically homeopathy can cure. Remaining beyond criticism, as Dr. Chakma has repeatedly told us, every day, every week, every month, we are curing number of cases. But how many of us are keeping records, documents, and showing our achievements, their recoveries, cures to our batchmates, friends, homeopaths, and the profession? See, as we stay in the country, we have to pay tax this way or that way. We are dealing with homeopathy, earning, we are being fed by the homeopathy, but we are not paying a tax for the system. We should contribute the homeopathy system to grow from everywhere and at any cost, I should say. That's a guilt if we do not contribute our success to other friends, other homeopaths, for the improvement of ours, our system, and for benefit of the country. It is a crime, I should say. So, dear friends, brothers and sisters, whatever cases you are curing, keep documentation as Dr. Chakma shows, before, during, and after. Keep the reports and present in the presentable form as it was presented by Dr. Chakma. That will inspire and that will be a great help to all of us in homeopathy system of medicine. I am telling repeatedly, simply. Say, for example, you have pure one diarrhea. But when that is coming to us, can you not check the OPC or routine stool for subsequent 3 days to find out the reason? And in between the treatment, after completion of the diarrhea, patient become normal. Get the again stool tested for 3 subsequent days and keep the records, publish it as in the pro forma guidelines shown by the Dr. Chakma. So simple cases, not necessarily you have to cure famous cases, diffuse cases. Whatever cases we are curing, let the world see that scientifically we are curing. This is very, very much essential. Regarding gastric disease, as we are discussing, erosive gastritis, it is a growing, ever-growing disease in our present society. That's why probably system, the nature, has kept this system, gastrointestinal system, in the middle of our body. Embryological, if you remember, if you can recall, you will see that we are basically one tube of gastrointestine by endoderms. To feed, to satiate its desire, mesoderm was made, muscles and other storage system. To maintain this proper chemistry of the gut, enzymatic system developed. Then ectoderm, nervous system, skin, other things, to protect, to keep final decisions, to coordinate the ectodermal system developed. So this endoderm, the foundation or basic germinal layer of our body is endoderm, and the prime area of this endoderm is stomach. I heard one very silly words, I should say very cheap words, but very true, that ये जिंदगी दोनों थैलियों के लिए, एक ऊपर वाला, that is stomach, और एक नीचे वाला, that is uterus. Means fertilization, generations. See, दोनों थैलियों के लिए, may not be all the people should be successful by uterine thalio, but everybody is busy with the first thalio, that is stomach, to feed it, to satisfy the desire. And whole day we are striving first for the food, good foods, better foods. By doing these things, what has happened, that nowadays we have become very fond of taking perverted foods. I may be excused for the language, because nowadays we don't like rice. We want boiled, your fried rice, or biryani, or this form, that form, oily, fried, this and that. Means prepared or deformed rice we are consuming. We are not very much keen to eat breads. We are giving other natures, deforming, by frying, by doing these things, noodles, then your this and that thing. Many your ready-made foods are available from making from the wheat. So this change of food nature, craving for spices, craving for artificial foods, craving for preservative foods, craving for packed foods, irregular diet habit, addictions, everything is ultimately stimulated in the gastric mucosa. If we are regular or irregular in diet habit, but ultimately we are irritating the stomach mucosa. Plus, mentally, we are facing 100 types of tensions, stress and tension, which ultimately through vagus nerve, through the autonomic nervous system, gastric secretion gets increased, resulting to acidosis, acid collection in the stomach. And you have learned that more there will be collection of acid, more there will be reflux from the duodenum to replace the acid. But this mechanism, reflux mechanism of the bile and high acid concentration of the stomach, ultimately pyloric antrum will be closed. Pylorus will not allow to pass the contents of the stomach to the duodenum, because the stomach contents has become toxicized by acid, high acids. Either that will be reflux out through the esophagus, or that will be sustained or retained in the stomach, will not be allowed to go down. resulting to irritation of the mucous membrane, ultimately inflammation, because how long the mucous membrane can tolerate the high concentration of hydrochloric acid. If any of you have experience of hydrochloric acid in the chemistry in school, one drop if you put on the palm, that will burn like anything immediately. Just imagine a huge quantity of acid if they are being collected or stored or they are not allowed to pass down. How much irritation, how much burning discomfort mucous membrane has to face. Fortunately, Almighty has given mucosal layer, submucosal layer, then muscular layer, and nervous layers are after submucous layer. That's why in the beginning, when mucosal layer gets inflamed or irritated due to acid concentration by the infections or by retention of the acid, ultimately mucosal layer gets eroded, then submucous layer, then complaints start coming, discomfort, pain, whatever. So when a patient is complaining, I am facing discomfort in my upper abdomen, either pain or discomfort or heaviness or lump-like feeling, it is already late. Mucous layer has been destroyed by erosion or inflammation. They are sick. They have allowed to acid to pass down to submucous layer, and that layer has been also disturbed. That's why the chemical concentration of the stomach is reaching to the nervous plexus of the submucous or muscular layer of the stomach and giving rise to pain, discomfort. So our diet habit, our mental stress and strain, day by day, it will increase gastric irritation, erosion in different places, whether it is erosive gastritis or simple inflammatory gastritis, primary stage or secondary stage. That's why all of us are facing this complaint almost daily. People are coming to say, I cannot eat properly. My bowels habit is not clear. Defecation repeated times, not clear. Stool is not formed. And facing discomfort in the upper abdomen with progressive weakness. Because the more stomach will be erosive, high concentration of the acid content food will come down to the gut. They will not be properly absorbed. Ultimately, in a very short period, patient will start feeling weakness, though he is eating good. That is why this erosive gastritis is a common disease nowadays, and it will gradually increase and increase and increase. What happens in the conventional system of medicine? Antacids, beta blockers, painkillers, many of them have got some ill effects, side effects. Much less, much less than homeopathy. But in our cases, by finding the symptom, safely we can cure the disease. The first complaint, Chakma told details, but the first complaint when patient comes to us is discomfort in upper abdomen after eating. Then when the stomach is full, acidified, it is full, heaviness of the abdomen. Means pylorus is not freely allowing the contents of the hyperacidic foods to come down to the duodenum. That is the heaviness, not getting appetite in time. Either eructation of the acid by reflux or not. When the patient comes to us, I told you in a bit later stage, when nervous layer has been affected, the erosion has gone to muscular layer. That's why patient has run to homeopathy doctor for his pain and discomfort, burning, etc. The first advice of us will be to reduce these contents of the stomach to become more diluted, to become more alkaline or bland, to become more colder, because heat will increase the pathology, which cold will not increase. That's why we should ask first the patient. We should first know the diet habit, what he's taking. Obviously, we get some irritating diets he's consuming, either by addiction or by diet habits. Our first step will be, from now onwards, you should take soft, bland, and cold diet. Soft means anything you eat that should not need to be mashed in the stomach, because your stomach is sick, is not able to mash your grains or hard food particles, because the erosive area will be more erosive if they have to face the frictions with the food particles. That's why first start very soft food. Rice, bread is no problem. Egg, meat, fish is no problem. But that they must be as soft as possible. They should not be allowed to be mashed or grinded inside the stomach. That will be equivalent to rest to the mucous membrane. So soft diet in any form. Next is cold diet. Anything heat, primarily vasodilator heat. So anything hot tea, especially tea is irritating for the mucus of the stomach when it is inflammatory. Anything hot should be avoided because that will vasodilate, that will increase the situation of the stomach. That's why things should be taken first soft, then cold, obviously. Third is bland, neither very chilly, nor very hard salt, not very severely fried, not boiled exactly, but as much as possible, the irritant should be avoided. Food should be bland, soft, bland, and cold. The first thing is that we have made our stomach ready to receive the foods, to be digested, to be mashed into a lot of food to pass out. The more there will be grains, the more food will be hot. Pylorus will further contract. They will not allow the hard grains to pass down to stomach unless they are properly mashed in the stomach. So retaining of the food particles in the stomach will further increase the acid level to aggravate the condition of the ocean. This is our first advice. Second advice is take plenty of water to wash the contents of the stomach to duodenum as quick as possible. More than your thirst, not less than 3 to 4 liters of water patient must consume. Next is patient should not be at empty stomach more than 3.5 hours because stomach emptying period is approximately 3 to 3.5 hours. So stomach must contain some soft, bland, and cold foods always. Otherwise, gradually the acid level will increase because mucus is sick. So acid pepsin digestion, the system of few steps will gradually be instigated by the stagnation of the acid. More and more will be acid liberation. Pylorus will be more strong to close the opening. Patient will suffer more and more. So ask the patient to take this type of food frequently, 3 to 3.5 hours, and not to take huge amount to reduce the load of the stomach. By which stomach can function normally. We should ask the patient to take up to your appetite, satiety of the appetite, not more than that. Take again after 2 to 4 hours. Never keep your stomach empty, especially when you are awake from morning till night. This is the first advice. Prevent further destruction of the mucous line. Then we'll be having case history. We'll start out the cases that Dr. Chakma are very common cases. What is my experience? I have seen, you can experience of your own, that there is one symptom in belly donor, that lump feeling in upper abdomen. I searched it out, tried throughout my life. I never found except gas in the transverse colon. Upper epigastrium, lump feeling is very difficult. Sudden lump feeling in the upper abdomen epigastrium is either by the accumulation of the gas, by percussion will be able to assess, but usually the colon structure is such that whenever in transverse process will collect gas, this will pass either to the left or right quadriflexion. It will quickly pass down because just above the transverse colon there is stomach hanging down. So for that pressure, transverse colon usually rarely accumulates gas acutely in acute states. Still, patient is complaining there is lump feeling, heaviness feeling in the upper abdomen. You try belladonna first. You will see the magic, especially for the cases has come for a short period, suffering for a short period, after eating something, or after eating or tension for a few days, sudden complaints, all the pain, discomfort, heaviness, soft irregular diet, severe weakness. First diet with belladonna, you find the symptoms, as I told you, the lump feeling without any other specific indications as homeopathy has told. So after giving belladonna, you will see the lump will get reduced. Means belladonna is to some extent vasodilator. Belladonna not only reduce the congestion of the stomach, erosive area, but also it will help the fibrous to open freely. That is why stomach will get rest. It is help, gives quick relief. Then sometimes, as he told Karmavik, if we find along with this complaint there is ineffectual stool going for several times, not getting clear stool, soft stool, progressive weakness, we can come next week or two. Very rare cases, I got some cases. That's a severe hunger. I cannot bear appetite. Immediately I have to take food. But whenever I eat food, complaint starts. Pain, discomfort. Abies canadensis is a fantastic medicine for this type of condition. Hunger severe with discomfort, pain in the upper abdomen. Gastritis. As you have learned from Dr. Chakma, that erosive gastritis is a specific pathology, may be done, may be occurred by H. pylori bacteria or by intoxications or irritating diets. This is a definitely irritating disease because whole system is being disturbed. The patient won't be able to do anything because of the abdominal discomfort. So with the diet control, with the medication, with a very short time, we'll be able to cure the cases. And these cases can be easily assessed by endoscopic examination or endoscopy. Whenever you ask for endoscopy, never forget to ask for rapid urease test, RUT, root, means to assess whether there is H. pylori or not, the commonest bacteria for erosive gastritis. Then stool examination, whether there is any specific pathology which is creating ill health of the gut, resulting to stagnation of this acid, formation of the acid or not. Anyway, necessary investigation, especially endoscopy with test of rapid urease test should be done to get it confirmed. Many times you are afraid of that patient don't be able to afford. It is painful complaints. The thing is that if patient goes to an expert, pain will be much less because local anesthesia, if it is not properly done, patient will feel pain. But if anesthesia is properly done, means local anesthesia by sprays and others, pain is not that much. It will be comfortable. And usually patient do not cooperate with the investigator doctor, endoscopy, who is doing endoscopy. If the tube is freely swallowed, there will be no pain. We should ask the patient, we should convince the patient, say, see, when you are swallowing, deglutiting a bowl of food, what is the size of the food? It is quite big, like a small potato. Every time we are swallowing, number of times when eating, but when you will get the taste, a narrow pipe have to be swallowed. Not even 1/5, 1/10 of the lump we are swallowing every day for number of times. So don't get worried. Close your eyes, simply swallow the tube. It will easily pass down. What happens is the patient gets nervous, tense, being afraid. They do not swallow freely. Pharyngeal constriction, pharyngeal spasm obstruct the tube, and the investigator is bound to push the tube down to the stomach. That's why the pain creates. That is why when you ask the patient to get endoscopy, along with you suggest that how to behave, how to cooperate with the investigator, that freely swallow as you are swallowing every day. Then fear will go off. Plus, if the patient cannot provide fund, we have the experience in NIH because NIH at that time did not have much scope for investigation. Refer the cases to some other hospitals. The hospital will automatically get the test in minimum cost or free. You ask the patient to keep the report, one copy with you. After a few days, again send the patient to another hospital or same hospital. They will do it. So collect the reports from the patient, a copy or the original. That will be documentation for your recovery. He will show your treatment. Patient will give his declaration that I was treated under this doctor in homeopathy, but I could not afford the fund. That's why I had to go to hospital. That will be enough. There are different means. There are means to get the test done in lesser cost or free. but we should not leave the case without being tested. In NIH, one professor, Dr. Om Priya Mishra, I am very happy that in outdoor he will tell the patient, you have to do the test, otherwise don't come to me. This should be our attitude, because we should try to save our homeopathy ourselves. That I am curing the patient without any credit, without keeping document. So we have to get the test. A patient will be confessing that he don't have fund, but when operation will be advised by conventional system of medicine, by selling something they will go for the operation. This is common mentality of the common people. So we should fix or strongly say that get the reports done, then your treatment will be started. Or start the treatment, ask the patient, I am giving you medicine, you will feel the improvement, but if you do not bring the result, I won't treat you, I won't be able to treat you by closing my eyes. So by this way, day by day, we should try to convince our patient to get the reports for our development, proper development. So anyway, fantastic seminar, very common disease, and day by day the complaint with this will come up. Tension will increase, stress will increase, irregular diet will increase, addiction will increase in spite of all trials, because people are not getting proper happiness, the real happiness from normal life. They are searching, hunting happiness for the very short time by addictions and other means. That's why this type of disease day by increase, we have to be very sharp and prompt to cure. Anyway, many thanks to all of you. Those who are on the screen and those who are out of screen will be see later on. You try the medicines. There are many other drugs. In the name of gastritis, there are drugs. In the name of symptoms, there are many drugs. It is not very difficult to select homeopathic medicine in any type of gastritis. This much I can tell you. Not like vitiligo, not like psoriasis. They are difficult diseases. But gastritis is a very, very common disease. Other than common symptoms, you will get number of abnormal, uncommon symptoms. Say, for example, I am telling one patient is giving all common symptoms of gastritis, but patient is telling, I do not compromise with anything. Whenever I decide anything, I will do it, whether bad or good. If I am destroyed, if I lose something, still I won't leave it. This type of conquering attitude, one day I told you, simply this symptom. If you get irregular bowel, it is well and good. If you do not get, simply by one mental symptom, we can think of Knox-Vega. Any complaints gets completely relief simply by vomiting. Complaints are there, things are found out, instantly patient complaints are free. We can think of Knox-Vega. There are many other drugs. Erosive gastritis, endoscopy was positive, endoscopy was equality. Patient saying, I feel better by eating. I can remain without eating. Always I want stomach to be filled. And the indication of anapadia. Anyway, there are many drugs. Report is enough to give us information. So, erosive gastritis is completely curable by us. We are curing. What we are not doing is we are not preserving the documents and presenting before the profession. Thank you very much. Bidyut, please.
Thank you, sir. Thank you so much. It has been an excellent learning phase. We like to thank all the person involved, the team involved in making this CME a grand success and the project a grand success for last 117 episodes, and this is the 118. All the speakers, all the moderator, the inaugurator, everyone. And there is a important announcement. Our alumni meet of NIH of 2025 will be in December. I had told previously also, 10th and 11th will be the program to commemorate the Golden Jubilee celebration, the 50th the birthday of NH, 50th Golden Jubilee celebration ending date. And after that, our director, Sir Dr. Pralay Sharma, had permitted to organize the alumni meet in NH campus. So please book the date of after 11th, that is 12th, and we'll be finalizing the dates very soon. And book your flight tickets, train tickets, so that this year we all can come forward and meet and enjoy our alma mater after so many years. And the details will be shared within the next few weeks by mid July. And our 119th episode will be aired on July 13th. Yeah, will be on July 13th, I presume. And that will be having a very important topic. We'll be having the topic of telemedicine, the call of the day, the people who are trying to use the technology for their practice and also for propagation of science, telemedicine opportunities and challenges. Our new team will be operating on that day, and we like to thank all tonight. And with this, we are returning back to the backstage editor, Dr. Orko Mukherjee. All those in the studio, please stay back after the live session ends.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, do make sure to give it a like, share with your fellow batchmates and fellow intern and other everyone of your fellow you know, so that they would get updates on new they get aware of this topic. This is a great topic to discuss about. And again, thanks for joining in. If you want to get update on our upcoming CMEs, go to the WhatsApp channel and join over there. We will post updates over there. You have to just follow it. And we're trying to get back online with that thing, that is our e-participation certificate. We're trying to do it, and I guess we will soon do it all. So good night. See you on our next CME. Until then, it's me, Orko Mukherjee. Peace out for today.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.